Good morning, good evening, good afternoon. Wherever you may be around the globe, we welcome you as we come together at a great time as one global mental health community in our MH for All webinar, ran by the United for Global Mental Health alongside the Lancet Psychiatry, MHPSS.net, and the Mental Health Innovation Network. This has been started since last year, and through this platform, we're able to share updates on relevant topics and learn more from the different people and organizations around the globe on mental health and its many intersections. I'm Ives, and I'm from Mental Health PH in the Philippines. For today's topic, capping off the challenging year that is 2021, let's look back at the enormous works and strides that we made together as a global mental health community. I am joined today by an amazing roster of panelists who will provide varying perspectives focusing on advocacy in a virtual world, with a focus on the progresses and lessons learned in 2021 and looking ahead to 2022 and what we can achieve more. I'm honored to introduce our mental health champions, not just on ground, but even in the virtual space. We have here with us Sarah Klein of United for Global Mental Health, Anne Will White of UNICEF, Arshinta of Yakum, and Alison Brunier of the World Health Organization. We highly encourage our audience to use the chat function to share your thoughts or questions. Great, great. Let's head on to our discussion, starting with Sarah. Sarah, what are your reflections on the key progresses made this year on mental health in 2021? And do you think working virtually helped or somehow hindered this progress?
Thank you, Ives, and thank you very much for inviting me to be here. I think a lot of people have had different experiences of what has or hasn't happened in terms of mental health this year, so it'd be really interesting to see what the audience has to say. From my perspective, I wanted to highlight 4 areas. I think the first is that the WHO Comprehensive Mental Health Action Plan that was agreed by all member states is an important moment. So it's the plan that was agreed for the period 2021 to 2030, and Alison can obviously speak more to that, but it does set out a series of goals and targets, and measurable targets, in fact, for all member states. And the very fact that that was agreed, and it was agreed with conversations and discussions around a much larger group of member states than have ever really contributed on mental health before at the World Health Assembly, was a really positive step forward. And the resolution that was passed in support of that. So I think the starting point is that mental health was higher up the agenda with health ministers themselves than perhaps in past years, and considerably more people engaged in those conversations from different health ministries and from different governments, despite the fact that it was virtual. And I think that is a testament to the work of people on this call and more generally around the world who've been calling for action on mental health. That doesn't come, I think that was clearly where that was coming from. A second point was that there was a more prominent discussion of rights. So rights was the focus for the ministerial summit that took place this year that was hosted by the French government. It was also something that was reflected in the work of WHO's Quality Rights Initiative and the new work that they published around communities and rights-based work in community levels. It came out very strongly in work published by UNICEF, and it's very much obviously a priority for civil society, including our colleagues here from Indonesia and other countries, including Philippines. So I think rights was discussed far more on a global agenda than perhaps in past years. It doesn't mean to say people are enjoying their rights, but it does mean that the conversation is taking place. So that's a good start. I think the third one was in national level. There was a lot of, I think when you look at what happened for World Mental Health Day, there were far more celebrations of World Mental Health Day, of acknowledgements of mental health day, World Mental Health Day in different countries. Again, that reflects a greater level of awareness amongst the public, amongst decision makers, amongst campaigners pushing for change. I think that's a positive step. Sadly, obviously, COVID is potentially a factor in that, but it's not the only reason these things have happened, and it's a testament to everyone's work. I think the last part was new research and new content, as well as new players. So obviously, Anne will tell you about the UNICEF report, but there were other reports coming out, other content coming out, other learning coming out. At national level, Mani in Nigeria, one of our partners, published a report on the impact of COVID on young people. We saw lots of different people contributing knowledge and understanding on mental health, and that's incredibly important, and sharing that knowledge. And then we saw new events, new activities again. UNICEF just had a Child and Youth Forum where mental health was one of the key priorities. We're seeing more organizations that are prioritizing mental health and talking about it. So new partners and new content. I think those are my four. You'd asked me about virtual and whether it was good or bad. I have mixed views on that. I think that the fact that the Global Mental Health Action Network has expanded to over 1,500 members from over 110 countries now is in part driven by the desire to work virtually to connect with people. And that would have happened, could have happened anyway, but it was probably accelerated by COVID. I think, but there are lots of benefits to working virtually, and many of us do. In fact, our organization has chosen to be entirely virtual, and it's working now because we are internationally focused. But the downsides are clear as well in terms of not being able to connect with people in real time and in face-to-face contact. And we all miss those opportunities that we had last year, even when we were meeting, and certainly the year before. And then we know that the personal impact on people's mental health of working virtually is not always positive, and people feel both lonely and isolated. And so the need to connect, to make connections happen, is more important than ever. So I'd say perhaps it was mixed, but on balance, we should be really proud of what we've achieved this year. Thank you.
Thank you, Sarah. Those are wonderful reflections to start with. And it's really a multitude of silver linings and setbacks due to COVID. And heading on to Anne, what are the key lessons that you're taking from 2021 into 2022 from UNICEF's work on mental health, particularly on the child and caregiver? And how have you utilized virtual ways of working for advocacy, both in the global and in the national context?
Thanks, Ives, and thank you so much, everyone, for joining in this today. I think that looking back, it's really interesting to think of which ways there are advocacy opportunities and moments internally within our own organizations and spheres to elevate the agenda of mental health and psychosocial support, and then also externally. And I think usually we think externally, that trying to think about how to raise it with key decision makers, policy makers, financing people with money. And so I think one of the biggest opportunities for us in the last year came with, as Sarah mentioned earlier, the State of the World's Children report. And it was a key moment that was lots of internal advocacy leading to external advocacy opportunities. So we launched the State of the World's Children report in October 2021, and the whole thing was entirely focused on mental health. And that is, to me, incredible. And so for those of you who don't know, this is an annual report for UNICEF. It's been going since 1980, and there's a different topic every year. And this is the first year that it was focused on mental health and exclusively on mental health. So really for UNICEF, a key moment for both internal and external advocacy is mental health. We chose the subject for the report even before the COVID-19 pandemic, but really this pandemic has highlighted even more the need to include mental health and psychosocial support across sectors and also across the lifespan. It also really highlighted the dire gap between what we have and what we need in terms of reaching our mental health goals for services and for advocacy. A really interesting learning, I think, also from the last year that has made it into a lot of our advocacy rationale is that before COVID-19, UNICEF was reaching around 4.7 million children and caregivers, which is good. But then just a year later, and this is just 2020 because we don't have the 2021 numbers, but at the end of the last year, 2020, it jumped from 4 million to 78 million. And I think that really highlights the need that people are seeing for mental health across a range of different areas. That's not just mental health interventions, that's also messaging and outreach and awareness raising. But nonetheless, I think it's really important, and an important learning for all of us from COVID-19 that this is really an essential topic. So because of all of this and a lot of other things, UNICEF has decided to make mental health one of its key advocacy priorities for the next 5 years, which is also pretty huge. So underpinning this larger advocacy effort is the narrative that the main preventable causes of poor mental health occur in childhood, but they're not inevitable. The advocacy strategy focuses on 4 accelerators, which I'll come back to again later. But these suggest that they have the biggest impact for children's, adolescence, and mental health. So those 4 accelerators are increased investment across MHPSS, across all sectors and settings, scaling up parenting support and programs to promote nurturing caregivers and supporting caregiver mental health. Number 3, mental health and support services in the school and in the community, which we can really see the need for throughout COVID-19 with the lack of access, but also the increased need to support teachers and all of that, and coming back, building back better, as we have said in so many different ways. And then the 4th is around stigma, really changing the public conversation on mental health. And I think we've seen the need for that also in so many different ways. And people are finally, I think, ready for some of these advocacy messages too. And maybe just to say, you had asked how we've learned from that in terms of working remotely as well. And I think working in person became more challenging, but it also has opened up some opportunities in terms of access. And I think Sarah alluded to this as well. But you know, in advocacy, as many of you know, it's not just about convincing everyone of your message. It's good to do that, but importantly, it's important to know the goals of the person or the organization you're trying to influence. B, figure out how your goals can overlap and support each other. And then C, make a clear ask. Know exactly what you want from the advocacy approach. And I think in some ways, the access to people and places that we have had by making it virtual has been much more interesting and influential, and gotten a much more diverse set of voices able to contribute to that advocacy in a way that hasn't been there before. One example of that, I think we had an opportunity with the US government. There's a bill currently hoping to be passed, the mental health bill with Senator Casey. And there was an amazing session that they had. I think it was midway through the year this last year. And I was nearly in tears. Senator Casey and a lot of other people were saying things about mental health and using the right words, talking about people from all over the world across the different ages and stages of life in ways that maybe they wouldn't have heard before if it weren't for having a lot of access to all of this virtually. So I'll stop there, but I think those are some of the biggest learnings. Thanks.
Thank you, Anne. It is noteworthy to see mental health take the spotlight in a powerful document like the State of the World Children Report. And if you want to learn more about that, our team from UGMH happily shared the link to it so you can access more about it. So we've heard it from UGMH and UNICEF, both working at a global scale. And how about we hear it from what's happening on the national level and get their perspective specifically in Indonesia. Arshinta, what has been the
Hi.
biggest challenge in mobilizing advocacy efforts nationally in Indonesia in 2021? And what have been your biggest successes?
Thank you, Ifas, and thank you, colleagues, for having me. Small sharing from Indonesia is that as a national NGO in Indonesia working in health issue, including mental health, Yakum is connected to more than 500 persons with psychosocial disability and their caregivers, and we have mobilized more than 600 young people to do campaign and also awareness raising on mental health in Indonesia. And we are grateful to see an increase in mental health awareness amongst our society, especially amongst the youth. However, we recognize that stigma and discriminations, as shared by some colleagues in the chat box, do exist. And still a lot of efforts needs to be done for campaigning the importance of mental health and how community can engage and do acceptance and protection to the rights of persons with psychosocial disability. Besides, there is no consolidated available information about actors and their respective works in mental health, especially in advocacy. As many have repeatedly said, the lack of data on mental health also overshadows the urgency of this issue. We, for instance, we do not have the data on the suicide rate in Indonesia. But we do have like the health survey, national health surveys the numbers of depression, etc. But still, people see it from the medical or clinical perspective. The biggest success I was asking, what we do cannot be called a success, but at least I shared with you, colleagues, that we admitted there are many needs to be done in this issue. But at least in a local level, there are some concrete examples. At least Yakum works mainly in Java. There are 3 districts in Yogyakarta do what we call multi-stakeholders coordination platform, which address the issue on mental health on on a regular basis and part of the local government's system. It also includes the models of community-based rehabilitations for persons with psychosocial disabilities, and it showed how society, community leaders, the health cadres engage and do some concrete actions and in campaigning mental health. In the national level, the Ministry of Law and Human Rights just recently, only last week, launched or inaugurating the task force that is mandated to do recognitions, protection, and enactment of human rights for people with psychosocial disability in Indonesia. So there are some hints that we make progress on this issue. Back to you, Ivers.
Thank you, Arshinta. Those are truly commendable. And now we've gotten share of what has been the key moments, both at the global and the national scale. Now let's head on to Allison. Let me pick your thoughts on this. How would you compare WHO's engagement with its member states and CSOs in 2021 as compared to previous years when virtual settings were less frequent?
Well, first of all, thank you very much for having me. Iris, good to see you again, and thank you to all of those that have joined us today. So certainly, perhaps as a first point, I'd like to pick up on something that both Sarah and Dan both spoke of, and that's the increasing accessibility of people around the world to join these conversations that we're having about mental health. And certainly with more and more virtual events, we have seen a lot more people engaging than would have been the case in the past, and sometimes hundreds rather than dozens of people, or thousands rather than hundreds of people getting together. And over the course of the last 18 months or so, I think WHO, the same as many other organizations, have become much more competent in hosting these types of virtual events. We've certainly had a lot of launch events of new products and new reports, new tools on mental health for governments and other audiences over the course of the last couple of years. For just a few examples, Helping Adolescents Thrive, which is a new toolkit that was produced with our partners at UNICEF. New guidance on implementing suicide prevention activities at country level. In addition, we've had the guidance on good practices for establishing community-based mental health services using a human rights approach, which was probably one of our most successful online launch events of the last year, I would say. In addition, we've used this new type of forum new type of online event to get together with partners, and such as during the Mental Health Forum that's now become an annual event, to exchange experiences, to exchange information on new products, tools, guidance documents, policy documents that have been launched over the last months. And I should perhaps also mention what Sarah started with, and that's the endorsement by our member states at the World Health Assembly in May of this year of the new implementation options and indicators of the global comprehensive mental health action plan. And that managing to anyone that's familiar with the World Health Assembly knows that it's not an easy task getting to consensus on these kinds of and resolutions on issues at all, but doing that in a virtual world is quite something else altogether. Having said all that, there's a difference between participation and engagement. And of course, one can participate in all these events without actually really engaging in the topic. And we have also seen the need, particularly I would say over the last 6 months or so, to be more innovative in our approaches, to engage people more. And we've done that in several ways. One, by using more the breakout rooms that are possible now in virtual spaces. We've also been using more consistently over the last few months Twitter Spaces, which are available, of course, to anybody, accessible to anyone on Twitter, and are more like online conversations with a number of guests without the video option. So there are many ways of engaging. My guess is that even beyond COVID, we'll be using virtual means a lot more to engage rather than face-to-face, or in addition to face-to-face means. So, and it's something we'll have to continue to innovate with in order to continuing to engage people.
Thank you, Alison. Advocacy in the virtual space is here to stay indeed. And thank you for highlighting the difference between participation and engagement, as well as emphasizing the call to be more proactive, especially in a virtual space. And wonderful to see how WHO's direction turned into fruition with the help, of course, of so many key players, especially our civil society organizations. And thanks to our panelists for giving us a glimpse, most especially to the success stories that we can learn from in 2021. With those takeaways, and now looking ahead, I know our participants are equally keen as I am in hearing from our panelists once again of what's in store for the mental health advocacy in the year to come with COVID-19 in mind. First off the list, UGMH. So Sarah, can you tell us more about the advocacy roadmap that you are developing? And what are the key considerations to achieve progresses next year?
Thank you. Yes, for those of you who are not familiar with it, for the last 3 or 4 years, we've written what's called an advocacy roadmap for mental health, which sets out what we know of as some key big political moments or processes that are happening that year that could influence mental health and the outcomes around mental health. And that includes political moments, it includes financing, it includes related topics at a UN and global level. So I think in the next, and we'll be able to publish a first version of that by the end of this week. It's almost, I'm responsible for it, it's almost done. With many help from lots of people who've been inputting, including Anne and Alison, in fact. In terms of looking ahead to 22, I think there are a few things. One is, and it came up as a question about how to sustain momentum on mental health beyond COVID. And that's a really good point. So I think I would say that this is a historic moment where governments are talking about the future of health, and they are looking at health systems and processes and universal health coverage. And we have to win the argument that mental health should be fully integrated within health, and universal health coverage means mental and physical health. So that's a key argument and a key message for us. It's something that the WHO, others are strongly echoing, and we need to keep pushing on that agenda. I think a second point is money. To Anne's point, Dan, if mental health needs money, and so it's on all of us to figure out the best ways, everyone's nodding, to persuade people to invest in their own mental health personally, but then also through the different systems and processes. And that means not just in health, but to Anne's point, in education, where there will be a major UN summit on education this year, coming up next year, but also in the wider sustainable development plans that governments will be putting together and then presenting to the wider public in 2023. A third part is around data. So we launched this year with a number of partners the Countdown Global Mental Health 2030 data initiatives, which enables people. It's actually inspired in part by Yakum and their challenges with finding data on mental health in Indonesia. So it's trying to drive data for action. So if people can find data, can they then drive more action and progress? And that will be important throughout the year and beyond. We'll hear more about specific political opportunities like the G20. It was great to see that the G20 this year included mental health, and I know that in Indonesia they're working on that for next year. I think 2 other areas then to briefly mention are the workplace. We're seeing a lot more in discussion around mental health at work, hybrid working, what does it mean to work from home more? There's a lot of discussion about mental health at work. That will be a big point of the discussion in next year. WHO will produce new guidelines on that with the ILO. There will be more work. And I think finally, climate change. It is a big conversation. There needs to be both a publication of what is the evidence, but then also an agenda for action. So that will be something that we'll be working on with partners, is to figure out, well, if we know that the impacts of climate change, either now or for the future, how can we act in order to try and mitigate those and to support people's mental health? So those are just some of the things to think about. Thanks.
Thank you, Sarah. So those are really good to point at, diving deep and going wide in terms of the advocacy and sustaining this momentum beyond COVID. So that's really something to look forward to. Thank you. Getting back to Alison. Alison, can you speak to some of WHO's major plans for 2022? And what opportunities are there for global mental health advocates to engage?
Well, thank you very much, Ives. First of all, the World Mental Health Report. So we're hoping to launch this in the first half of next year. And this report, which is a very comprehensive look back and look forward, comes 20 years after the World Health Report on mental health, the only World Health Report that WHO has issued on the topic. It really aims to support a global transformation of mental health services. As I say, we'll look back at what's happened during the last 20 years and look forward at where the opportunities are. It will include the latest evidence on mental health, showcases good practices, and draws on the lived experience of people who are living with and have lived with mental health conditions. So that will be probably our major report of the year. Secondly, as Sarah mentioned, the first WHO guideline on mental health, which has been the result of a 2-year process of development, and will include information and guidance on best practices in the workplace for supporting people's mental health, and also how work impacts on people's mental health. Thirdly, a scientific brief on the impact of COVID-19 on mental health, which will be a compilation of conclusions from quite a vast study of all the literature that's out there, studies that are out there on the impact of COVID-19 on mental health, and hopefully can be used as a tool by partners in really showing what that impact has been. Fourthly, dementia research blueprint. So really to help guide dementia research efforts over the course of the coming years. And a condition, of course, that it is affecting more and more people every year. And last but not least, the Global Action Plan on Alcohol 2022 to 2030, which, all being well, should be going to the World Health Assembly for consideration next year. Now, in terms of advocacy opportunities, of course, when we'll be sharing more information about them as we get closer to launch with partners such as United. Of course, once they're actually released, we hope that people on this call, advocates, civil society organizations, will help us disseminate them. And when you're talking to the other stakeholders in your countries, to share some of the key messages, some of the recommendations that you'll find in these documents in order to help move forward the mental health agenda. And I include in that work on substance use and addictive behaviors as well.
Thank you, Alison. I hope we're taking notes there, but for sure, if not, there'll be a post-webinar recording available for everyone. But thanks, Alison, again for this useful information and highlighting the different work streams showing the intersectionality of mental health. And on to another organization. And how can a global organization such as UNICEF work with others, such as the civil society organizations, to ensure advocacy in the digital world is effective?
Thanks, Ives. I mean, I think really, how can we not? I think it's essential for big organizations to work with local contextual organizations and ideas and advocacy efforts in order to be worth our water. Like I think otherwise the efforts are pointless, because that's what we're doing it for, are for the people around the world and the different contexts and the different efforts and the different challenges that people are facing. So in order to do that on our side anyway, with the advocacy strategy that I mentioned before, that where UNICEF has prioritized mental health, we've not just done a global advocacy strategy, and especially in 2022, we're ramping it up to be country level advocacy strategies. So we're adapting all of the different messages, or at least building from ground up on those different fronts to ensure that it's contextualized and relevant, both in terms of theme, but also in terms of approach, and making sure that it's reaching the right people and on point and in the ways that are needed for the needs on the ground. So we'll be adapting the global advocacy plans in 25 different countries, and that's set to be done by 2025. We've already started in 8, but next year, 2022, will really ramp that up. And then beyond UNICEF, we co-chair the Global Mental Health Action Network group for children and youth mental health. And I think there's a lot of opportunity that we're really looking to harness for 2022. We've joined together with the child and youth group with the finance group, and hoping to really have some key strategy initiatives for 2022. And I think there's a lot of things where, you know, I saw Carmen also in the chat mentioned, how can we make sure this isn't just about COVID? And I'm feeling that really across the board, that, you know, now is the time to make sure that these things are continued, but not only be maybe spurred on, hopefully, by a lot of the oomph that we got from COVID, but maintaining that going through, because really all of this existed before COVID. We all know this. A lot of us, you know, we've been working in this area for years, but really making sure then that our messages and our approaches are relevant in a post-COVID or continuing COVID context. So, you know, I think one of the challenges through that then is retaining that context and humanity through the screen. How can we learn from a lot of these and these opportunities that we've had by being remote, but making sure then we're not just sort of saying the same things in every different country and every different context, but really making sure to still individualize and contextualize and localize the efforts and the advocacy messages.
Thank you, Anne. Humanity in stream. What a word. Love the energy and collaborative environment, and hoping to sustain this, or better yet, scale up in the years to come. And I myself is a personal testament to UNICEF's amazing work and how they engage well with the youth, and hope to see more of you here. Join the functional committees of even the Global Mental Health Action Network, and our team from UGFH are here to answer further questions about this network. And last but definitely not the least, for Indonesia, Arshinta, there are some big moments that we hope we can harness the advocacy. And I believe Sarah mentioned this briefly a while ago. Given the G20 presidency is with Indonesia, what are you hoping to achieve for mental health in 2022? And how will you tailor your advocacy efforts to get there?
Yes, I was. What we plan to do, and also be informed by Sarah about the talk that Global Mental Health have with the Italian CSO, C20. We hope to enhance the multi-stakeholders collaborative work on promotions and prevention action for mental health by engaging wider faith-based institutions and also youth community. One thing that practically we have in mind is to mobilize our vast interfaith network, because Yakum is connected with national Muslim, Christians, Catholic, Hindus, and more faith network to participate in online survey on stigma and discriminations that will be done by the Lancet Commissions and the Global Network, including the Global Mental Health Advocacy Network. And Yakum is also the member of working group on health and vaccines in C20 Indonesia. And we have proposed mental health to be included in the policy brief of C20 of the working group health and vaccine and be discussed in C20 summit next year. We see media is also a key actor, and C20 and other engagement group like women, youth will certainly engage media partner to cover our joint statement on the importance of mental health in C20 summit next year. That's at least some of the things that we plan to do, utilizing the huge momentum of G20 presidency in Indonesia. And we are glad that we are also connected with the Sherpa and Sherpa from Italy and Indonesia, and also the next one in India. I think Global Mental Health Advocacy Network has the members access and work in those countries. So we have a huge opportunity to utilize such momentum. Back to you, Ivers.
Thank you so much, Arshenta. You'll never go wrong really with collaboration, and we look forward to hearing more about success stories in Indonesia or even other communities as well. And wow, what a jam-packed learning we had in the past 30 minutes or so. And I can't thank enough our panelists for sharing their experience and learnings in maximizing the power of virtual space for mental health advocacy. And at this juncture, how about we take in questions of our participants? First, to get the ball rolling, so this is our Q&A session. For everyone, for our panelists, what are your views on how to keep this momentum beyond COVID? So as this is not only a COVID thing. Who wants to go first?
Me?
Sure, Arshenta, go ahead.
Yeah, lovely to meet Carmen virtually here. Long-time colleagues from CBM in the past. Yes, Carmen, it is very correct. With our network in Indonesia, Yakum, because Yakum also works for quite some years, like more than 20 years, we have been working on HIV AIDS prevention program. We just recently reflected with colleagues from the peer support group of HIV/AIDS. One factor that creating the loss follow-up medication is actually not the lack of provisions or availability of medications, because it has been protected and insured by government. But the fact is, amongst our friends of HIV positive, one thing that makes them drop off from the medication is the depressions, especially with COVID things, because they are losing jobs and many other factors. So the depressions that they have is making them withdraw from the medication. So we think after COVID we have to back to our so to say old business in promoting and preventing HIV/AIDS by integrating and mainstreaming the mental health issue within the HIV/AIDS program. And also because one of the office under Yakum is also working for disaster management and climate change adaptations. And a while ago, when Sarah and colleagues from Global Mental Health hosted the national consultations, the global consultations on the next agenda, we see also the importance of integrating the mental health issue in climate change, because many local indigenous populations in Indonesia, they are exposed to mental health issue because their environment ruined by the fast development that are not anticipating the impact to the people. So I think beyond COVID, we have still many things to do, and also opportunities to integrate mental health in the daily health issue as well as development issue. That's one thing that I can share with you guys.
Thank you, Arshinta. So we don't stop from here. How about we hear it from Sarah?
Thank you. I'm conscious I addressed it slightly when I spoke before, but as I said, integrating mental health in the wider health system is very important, and then across sustainable development. So all governments will be going to an SDGs summit in 2023, where they need to report back on their progress against the SDGs. And I think this will be a good opportunity to reinforce the point that mental health is not just a health issue. It is through environment, it is through, as Ashanta just said, it's education, social welfare, things that I know Anne feels very passionately about. And so it will be really important that governments are persuaded in the next year to really integrate mental health fully. We ourselves will be working on the Global Fund to Fight AIDS, TB, Malaria, who have just changed their policy to better integrate mental health. So we'll be working to try and make sure that happens in practice. It will be an important time to try and engage with them as they go forward in their work. And then I think more generally, in terms of momentum, there will be a lot of opportunities to make the case for action using these different political moments and then the content that Alison and others have talked about. And I think we can draw huge comfort from the progress that we're hearing at national level, as we just heard about from Indonesia. And then I don't know, Ives, if you're going to say anything yourself, but with the elections coming up in the Philippines, we're seeing new ways in which partners are pulling them together as coalitions to achieve change. And I think that's really exciting. Thank you.
I agree. Thank you very much, Sarah. How about we hear it from Alison?
Thank you very much, Ives. So I think it's fair to say that the momentum towards action for mental health was already growing even before the start of the pandemic. Although it's also fair to say the recognition of the importance of taking action has become even clearer during the pandemic. So another point I wanted to make is that the mental health impacts of the pandemic aren't just going to go away. We don't know, first of all, we don't know when the pandemic is going to end. But secondly, the impacts on people's livelihoods, on people's physical health, on people's ability to get together, all of these things are going to go on for some time yet. And so will continue to have an impact on people's mental health. But nevertheless, we can't take anything for granted, as we all know. And people on the call can rest assured that at WHO we will take every opportunity we can, some of them that have been mentioned on this call, but there will be others too, to continue to advocate for mental health services as part of the overall health system, in order to ensure that in the coming years, mental health services are available in primary healthcare and hopefully in community-based settings.
Thank you, Alison. And now with Anne.
The two things that I had written down quickly to say were on the integration piece and the fact that it's not going to be over. It's not over when it's over. So yes, thank you, Sarah and Alison and Arshinta. You also touched on those themes that I think integrating into social welfare systems, not just on services either, on workforce development, on all sorts of different angles. Research is going to be essential for continuing the momentum and making people interested about how it improves their own outcomes. If someone's interested in economic outcomes, I think we can very clearly show the connection to mental health. If someone's interested in GBV or other social welfare outcomes, I think we can very clearly make the connection to mental health. So I think it's also about drawing those lines when we are making the intersectoral argument. And then, as Alison said, the impact is not over. It's going to be going for a long time. And I think no more will this be, is this necessary already, than with children and caregivers, and sort of mitigating those impacts, educational, social, emotional, economic, for still the years to come. I mean, this isn't our area, but I often see the statistics on how far back we've been set with COVID across different economic areas and educational areas. And so I think also then drawing those connections to the mental health impacts of those sorts of setbacks and goals, I think is unfortunately necessary. So yes, I think those are the ways that we can make the momentum still happen and also maintain the momentum that was already going. Like Alison said, I think we were already making huge progress in a very positive way.
Dito on that, Anne. And allow me to ask you another question. So this one's for you. So UNICEF MHPSS specialists are needed at the country level, and bureaucrats are not always educated about the mental health needs. Therefore, programs are not always very comprehensive. How do you think this gap could be addressed?
Thanks. So another thing that we've been really lucky to have in this last year is some set aside funds internally at UNICEF to try and grow our internal workforce as well. So we actually are now starting to we have now 4 regional MHPSS positions. We're hiring for one right now that will be based in Bangkok. And so that, I think, is a really big step for us in trying to improve the mental health technical capacity within UNICEF, to therefore influence that that response on the ground to be more comprehensive, and support that advocacy piece also with the regional advocacy plans that I mentioned earlier, to hopefully support the bureaucrats and others who might need to know a little bit more. I think another really important aspect to this is we've joined along with WHO in the last year and a half to create our own joint program that is a great initiative between our 2 organizations that can really blend our expertise and reach within the regions and the communities where we work. So we're really hoping to improve on that, and it's something also that we try to work for every day.
Thank you. Thank you for sharing those initiatives, Anne. And this one's for Allison. How can we develop effective and ethical leadership in mental health in settings where mental health is given low importance? To what extent does the WHO monitor progress of activities at the country level? Over the years, technical working groups are formed, but unfortunately, at some point, there can be a few can be delivered. What can be done?
Okay, perhaps I can start with the second part of that question first, and that's does WHO monitor what's happening at country level? Well, the answer to that is yes. And I put in the chat a little while earlier a link to the Mental Health Atlas, which is basically a document that we put together every 3 years, which looks at country level what is existing in terms of mental health resources, be that policy, be that law, human resources, finances, data systems. And through that mechanism, we had, I think, 171 countries that responded for providing their data for 2020. We can see whether there has been progress and where there hasn't been progress. Unfortunately, the report that we released in October showed that we're a long way from where we need to be in terms of the targets that are in the Comprehensive Mental Health Action Plan. So it's also a warning sign that of where there needs to be a lot more work. At the moment, just to be specific, that report includes country and global and regional data, but country profiles will follow a little bit later on. With regard to what can be done to encourage leadership to take more action on mental health when there is either little interest or little funds or little knowledge, well, all of those things need to be addressed, and there are many ways of doing that. And as I guess most people on this call know, WHO works through its country offices directly with governments and directly with partners who are on the ground to try and advance that education process, that advocacy process. Perhaps just to mention one of the projects that has been, if you like, a foundation of our mental health work at country level over the years is the mental health gap training. So training of generalists to provide first-line mental health support, to recognize mental health conditions, and to be able to provide initial support, at least, to people in need. And that's been something that's been going on for well over a decade. Support has been provided, or training has been provided in over 100 countries. And that's the kind of project when there are very few specialists trained and available in a country that can help to build mental health services. But the governance, the leadership that was mentioned in the question, there are many ways of doing that. And of course, our colleagues on the call here in United for Global Mental Health are very active in this area. And organizations like yourselves who are working at, like your own, working at country level every day, knocking on doors and trying to push bit by bit for change and understanding and increased action to improve mental health services.
Thank you very much, Alison. And perhaps Sarah and Arshita can either join there, but this will be the last question. How do we ensure persons with lived experience and their voices are included in the 2022 advocacy priorities? And what do you think should be the best practice in this area in 2021 that we can carry over to 2022 and beyond? Go ahead, Clara.
Oh, thank you. I know Ashinta wanted to speak as well. I think that one of the benefits of virtual working has been that it has increased perhaps the number of people with lived experience who've been heard in these forums and now be part of the discussions. And we've seen that all the way from webinars that we've been involved with to the recent inclusion of Joshua Duncan, who's a partner that we know well from Sierra Leone the other week in the Peace Building Commission discussion around mental health, which is very powerful. I think to continue that, it's a combination of obviously creating as many of these virtual opportunities as possible, but it's also about, in the way that Quality Rights and other initiatives have done, thinking about how people with lived experience are part of the solution as well, and so how they themselves are involved in the design and delivery of services and support. For ourselves, we're actually really pleased today to announce that we've appointed 2 additional trustees to United for Global Mental Health, Enoch Lee and Peter Yarrow, precisely to help further strengthen our work and engagement with people with lived experience and also people living and working on mental health in low middle income countries. And I think some of it is taking that step as well and ensuring that the consciousness of how people are involved in your processes and in decision making, which we're already doing informally, but this formalizes it at board level. So I guess those are some of the things I would mention. Thanks.
Thank you, Sarah.
Adding, yes,
Arshita?
I first, yes, adding to what Sarah has said, sharing with you the local context, Yakum has been working with a network of what's so-called self-help group, and in each self-help group, they are led by or co-chaired by the person with life experience. I think this will be one of the strong basis, strong foundations, and we also will consult them with the G20 agenda, what I have shared with you previously. But in the past, also I recalled myself, before COVID, we have engaged them together with CPM and WHO. I think in 2019, we did the Q rights training nationally, and some of the person with lived experiences also also engaged in that time. So I think such investment can be also replicated in the next future, and the person with lived experience will be the champion of this movement. I mean, we do not only engage them, but they also need the capacity building, and Q rights, quality rights will be one of the key component in the capacity building that are provided for person with lived experience. So, and also before I forgot, colleagues from WHO Indonesia is sharing their plan to utilize the WHO website for what's so-called mental health framework, in which they accumulate the stories of various practices in local level, in country level. And I think one of the biggest contribution from person with lived experience is that sharing their stories, sharing their practices in such platform. It is not started yet. It will be done shortly in next year. So I think that will be also one opportunity that we should utilize. Thank you, Ivas. Back to you.
Great. Thank you, Arshinta, and giving the importance of persons with lived experience at the core of our advocacy of being with them in this journey. As much as I am mindful of the time, unfortunately, we can cut off questions from there, but do not fret. Questions will be documented and will be accessible shortly through the efforts of our UGMH team. But before we formally close our discussion, let's stay true to our topic today. Utilizing mental health advocacy in the virtual space. So just a quick roundup with our panelists. Suppose you were to tweet this answer to the question. What are your mental health advocacy targets for 2022? How about we start with Arshinta?
Yes, I think the advocacy target will be I have to actually I was one, together louder for mental health in 2022, and secondly, if is to move towards multi-stakeholders collaborative work on mental health actions by mobilizing significant engagement of faith-based institutions and youth community in Indonesia.
Great. So hashtag move for mental health in Indonesia. How about Alison?
Well, you're putting us on the spot now, Ivis. But what I would like to see in 2022 is a comprehensive mental health action plan available and present in all ministries of health around the world and being used in collaboration with organizations like our own to move the needle forward on better mental health services for more people.
Great. So that's like hashtag forward collaboration. And how about Anne for UNICEF?
Thank you. So increased investment, caregiver mental health, school and community mental health, and addressing stigma. And also, it's not just for us, it's for everyone. We actually do have a hashtag. Please join us at hashtag on my mind and let us know how mental health is on your mind.
Indeed. So hashtag on my mind and hashtag 4 pillars. And last but not the least, Sarah for UGMH.
Thank you. As we were just debating this yesterday and we don't have a solution yet. So things that I suggested were, I think, mainstreaming mental health is key in the next year. And secondly, delivering change on the ground. We've done time to talk, time to act, time to invest, but it's now deliver. So I think delivering change and mainstreaming mental health. Thank you.
Great. So hashtag mainstream mental health. And thank you very much once again to our panelists for the lively discussion, and let our call to action be for our participants. Continue the discussion beyond this webinar. We look forward to hearing your thoughts and impressions virtually. So you can use it in Twitter, Facebook, Instagram, or even TikTok. Let's hear it from you and use the hashtag #MH4All. And I'd like to take this opportunity to invite you all to yet more learning this 2022 with the next webinar happening this new year sometime in January 2022. So this has been Ives Zuniga. Happy to have chaired this session. Good day, everyone, and happy holidays. Bye-bye.